So we proceed with our model. So usually, stand up. We inject our patients lying down. So here we have to inject the patient like while seated, because first of all we need to address the pathology. We need here, okay, and you know better we need here from the side. Okay, good. So first of all we need to do the diagnosis, because even what I believe, I'm a classic dermatologist, but I'm very much involved with aesthetics. I'm injecting for, I'm injector, I'm faculty for every, pretty much every company, for Allergan, Ipsen, Merck, for everybody. So we have to first define the indication, because the indication, the problem, will tell us what we can do to our patient and what we can promise to him. I remind you, the patient is paying, is asking for results. So, is all of this fat? No. Is all of this treatable? No. Why? Because some of it is genetic. So, if we want to treat genetics, we have to go into plastic surgery. Can plastic surgery make this neck like the Gigi Hadid neck? No. Because this patient is more beautiful, okay? So this is a compliment for you. Smile. So what we can do, we can treat the excessive fat, okay? And we can treat this sagging. You can see that? So this is the job. This is the job from lipase, and this is the job for liase. What are we going to do? First of all, we're going to mark the problematic area. For our patient here, chin down, okay? So, for our patient here, the problematic area is from here, here, okay, and goes up to here. So now we know which is the area to be treated, okay? We will have a total volume of 6 ml, okay? So we're going to distribute this volume. So the company gives the protocol, and according to the company, the injection had to be here, 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 and then here. But as I told you, I don't like protocols. So I don't feel, because I have experience with the product, that this area and this area need the same amount. So what I'm going to do, I'm going to save the amount of product that should be injected here to treat the area here, here, and here, which is the most fatty place of the problem. Because we have to adjust our protocol according to our patient. So it's not like maths. It's a little bit of maths and a little bit of trigonometry. So I remove the company from my side and I play on my own now. So what I do, I have a patient that the problem is mainly centrally. So I'm going to inject 1, 2, 3, and then I will do the fading outside, like here, 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 and here. So the company gives the protocol of a total amount of 6 ml. For this lady, we're going to inject 1 ml on each point. So according to the protocol, we inject deeply with a 30 millimeter needle, and we do a retrograde technique, which means that while we retract the needle, we're still injecting. If it's not very easy for you, you can inject, go a little bit out, retract, inject, and then this is a more stable technique. It's not wrong. I think it's more comfy. Whatever is more handy for you. So, does this come up? Okay, if it doesn't come, I want here perpendicular. No. So you can come here and you can show us a little bit what we're doing. So reconstitution. So in the bottle, you will find, in the box, sorry, you will find the syringe, okay? The syringe. The enzymes. It's like Botox or Dysport or Botona or Letibo, you see? So it has to be reconstituted. So you will add this volume to this vial. Then you have a diluent that's approximately 18 ml. For the high, it's 20 ml. So according to the indication, you are going to retrieve the amount you need from the diluent and put it here. So if it was for cellulitis, we're going to use the whole vial. But for now, since here we have 2 ml, we're going to use only 4 ml because we need a total amount of 6 ml. So we open the vial. Okay. No. Okay. We put the hyaluronic acid into the enzymes. We remove the air, you see, because we don't want to lose any product. We mix it, okay, it's ready, doesn't need a lot of effort, you see. And now we're going to add 4 ml from the liquid into the enzymes to have a total amount of 6 ml. No. So in this vial, we're going to add 1 ml, approximately 1 ml of lidocaine, because we need to make the enzymes, the injection, a little bit more comfortable for the patient. So what I do, I made the first injection centrally, and then I move lateral, because once we do the first pinch, then the patient is a little bit numbed. So as we walk lateral, as we inject lateral, the whole place is being numbed, and it's very comfortable for our patient. So now you see we took 4 ml from the solution, and we're adding it to the enzymes, okay?
Dr. Bageorgou, you have 5 minutes late.
In less than 2 minutes, we're done.
Thank you.
Βάλα μου και τα άλλα 2 εδώ. Στην άλλη, τα 2 ml που έμειναν, βάλτε τα μου εδώ. So now I take the 13 millimeter needle, okay? Δώσ' μου μια γαζούλα, με κτενισέ. Okay. No, up, move her up. Okay, ready? Okay, okay, so. Do not inject onto the marker to avoid making a white tattoo on the skin. So, we pinch a little bit, we retract a little bit, distract a little bit the patient, and then 1 ml, okay, in a retrograde technique, you will see. Okay, this is it, 1 ml, okay? We move farther, perpendicular. Retract the skin to avoid any kind of injection on places we don't want to. Okay, 1 ml, you see I'm moving outwards, moving outwards, moving outwards. That's it, okay? If you are a beginner, I will advise you to aspirate a little bit. Of course, here we have a lot of fat, we retract the skin, but if you have a thin patient, it's better for you to aspirate. So here, I'm at the end of the fatty place, so I will not go up to 2, I will inject half the ml, okay? So, are you okay? Is it painful? A little bit? Okay, good. So, the area of major concern is pretty much done. Now, the painful part of the injection is when you press a little bit, because the enzymes are being are becoming a little bit stressed. So you see, again, I go perpendicular here. Okay, we inject, we're coming out. I inject most of the part deeply, and then I'm going out. You see? Again, most of the part perpendicular deeply, and then while I'm coming out, I treat the rest. You see, the injection is deep. The patient do not usually have any bruise. They can go back to their job. They had a little bit of, maybe they will have a little bit of edema. Again, we go perpendicular. We aspirate, because here the skin is less fatty. Okay, we go deep. And then while we go out, retrogradely, we leave the product retrogradely. Okay. And this is it. You see, we don't have merely no blood. And now, I have the rest 2 ml. And I'm going to show you to share with you a little tip I do. So, I go like this, as if I had a cannula, and I treat the area from the side to make sure that all the fatty tissue is treated. You see, I'm very deep, but I'm treating it as if I was doing the injection with a cannula. So then I go this side and do the same thing. And practically we are done. Last injection. That's it. Very important thing. Do not apply any ice. Do not apply any heat. Do nothing. We do not rub it. We just push it a little bit. When you push it, it's very painful for the patient for, let's say, 20 seconds. And then the patient feels nothing. What you see is a little bit worsening of the area because of the volume. We have added to the problematic area 6 ml of volume. So this, during the following days, is going to be absorbed. Maybe the patient will feel that the area is a little burning, but most of them feel nothing, absolutely nothing. We will going to ask the patient to come back in 15 days to do the injection again. And we're going to assess the result. You need, for sure, 2 sessions. Then, if you want to have better results, maybe the patient, according to the fat of the area, maybe they will need 1 more. But usually with 2 sessions, they have very good results. If you have a very fat patient, maybe he needs more. Keep in mind that this is not a fat reduction method. This is only for people that have a localized double chin. It's not for somebody that is fat to control the weight and slim the face. So according to what is your indication, you can have the results you want. With our patients, we can be either safe or efficient. With this product, we can be both at the same time. So thank you so much. If you want any help, I'm here for you anytime. Thank you so much.